Now, most of us are guilty of it, turning to Dr. Google for health advice, or maybe for you, it's an Insta or TikTok influencer, or even an AI chatbot. In her new book, Bad Influence, How the Internet Hijacked Our Health, the award-winning journalist and broadcaster Dr. Deborah Cohen looks at the state of healthcare when people turn to the likes of ChatGPT rather than their own GP or doctor. And she questions whether the wealth of sometimes dubious information online might be doing more harm than good. And Dr. Cohen joins me here in the studio. Welcome.
Welcome. Thank you for having me on.
How has the internet hijacked our health?
Well, it's lots of different ways, really. But if you think about what these platforms are actually geared for, they're geared for eyeballs, so entertainment, but they're also really geared for commerce and selling. And in many ways, they're unregulated advertising spaces. TikTok alone has got over 3 million health providers on it. So people are turning to it for advice. They're being targeted with advertising, undeclared conflicts of interest. So people are selling them stuff. They're developing what we call parasocial relationships. So developing these senses of intimacy and friendship, and then almost selling against it. So everything from health coaches, which are unregulated, therapists, which is not a regulated term, through to online pharmacies, clinics. And they're making claims that are not necessarily evidence-based and, again, poorly regulated, and it's happening all around the world.
But Deborah, are they turning to these sources because there are gaps in mainstream medicine?
Absolutely. I mean, we've seen in the UK specifically, but all around the world, health systems are under huge pressure. And one OBGYN obstetrician gynaecologist I spoke to from the US said to me her young patients are waiting almost a year to see her. And in that time, they've probably spent about 4 hours a day on TikTok. So when they come to choices around their contraception, so oral contraceptive pill, coil, and so on and so forth, they've had a lot of time to absorb all sorts of information on these platforms before they come to see her.
Are we also seeing a change in what people are expecting and what they're hoping for in terms of health advice and also health solutions? I mean, within my own work, I know that looking at standard health behaviours like exercise and arts engagement as well, it can feel like it's almost old news, whereas we've got this appetite for biohacks and wonder drugs.
Absolutely. And that was one of the things that I'm really interested going forward, how these platforms, these relationships that people develop online affect sort of doctor-patient relationships, psychologist healthcare professional relationships. And there's a sense, I think, in a lot of quarters of not being heard, particularly with women who report not being seen and heard by the health service. But at the same time, there's a push for one quick fix, like biohacks. Everything's sort of, not everything, but a lot of things are reduced to neurotransmitters, serotonin and oxytocin, all those things, and hormones. So we talk about, can I get a dopamine fix? Can I get a serotonin fix? Testosterone, HRT, or menopause hormone therapy. So, and then, as you were saying, Daisy, all the biohacks, and there's not good evidence for them. And I think it changes people's expectations to a certain extent of what medicine can and can't do.
Kenneth, listening to our conversation from New York, I wonder what your relationship is like with the internet and your health.
Well, I mean, what I worry about is, people, first of all, have trouble seeing a doctor because there's just not enough of them or it's too expensive. But also, it's hard to see a doctor. And psychologically, it's just easier to go to the internet, to go to social media. And what I worry is, given how much disinformation is out there, say the anti-vaxxers, is, how does ChatGPT or the other chat box, how do they, do they just replicate this bad information? Because if that overwhelms the internet, is that what is fed to people? And what is this going to do long-term for people's health?
And that's a really good question. Only yesterday, I turned to ChatGPT. One of my family members was put on has high blood pressure, and they gave me the brand name of the drug. And I wanted to know the generic name, couldn't remember it off the top of my head. And I got 3 different answers from ChatGPT according to which prompt I put in.
Exactly.
And it's concerning. And it's exactly that. And it is filling a gap. And it's not all bad. And people can develop community on there. They can find tips and advice. And I'd hate to say it was all bad. I spoke to one breast surgeon who'd had breast cancer herself, and she found a community of support online when she was going through the worst of her chemotherapy and having nausea and sickness and felt tired, and people sent her blankets and there was a lot of care. But equally, I think some of the large language models are picking up the bad information. When I was researching testosterone, for example, it referred me to online pharmacies, which both in the US and the UK, they're the two hotbeds of misinformation around testosterone as it happens. They referred me to those clinics for the information as opposed to sort of evidence-based guidelines.
I also think it's interesting how organisations are selling products as well, because you mentioned about talking about neurotransmitters as well. It's almost like they know people want the hard science, but people forget that you get dopamine release from things like listening to music as well. It doesn't have to be drugs based, but somehow it feels like we trust something when it comes in a pill more than we trust much simpler things in our lives, even though we're actually risking a lot of other things, including potential side effects and other unknown ingredients.
Absolutely. I mean, the old Chief Medical Officer of England, Sir Liam Donaldson, said if exercise was a pill, it'd be called a magic bullet. And sometimes I think having a pill is easier. I spoke to one doctor in the US based around Harvard, and he runs a men's health clinic, and lots of men come in wanting testosterone. And it's not for symptoms that would be improved by testosterone. Testosterone actually, as it happens, has a massive placebo effect, both in men and in women. But it wasn't for those particular symptoms. And he said, well, you'd be better off dealing with your depression and your obesity and your diabetes, type 2 diabetes, your cardiovascular disease. Testosterone isn't going to do that. But he said he's just fighting this tide of misinformation. And people want the testosterone. And he said, in men in particular, he thinks that depression's quite stigmatised still. And it's easier to say, well, it's my testosterone and that's what I need, as opposed to addressing the sort of other causes of their ill health.
Which leads me back to you, Kenneth, because you talked about your own reluctance to go to a doctor. And I wonder if that's a kind of broader tendency we see amongst men, in your opinion, and whether they might therefore turn to the internet a lot more.
Well, I think what happens is that, you go to the doctor and you may get advice that you actually don't want to hear. It's going to be difficult advice to follow. And, the problem with the internet is you can pick and choose your advice. You can just keep looking for the website, keep looking for the answer from a chatbot that will ultimately, give you the easy solution, as Dr. Cohen is suggesting. And so, that's what I worry about. This is, not objective medicine. It can be very, give me what I want medicine.
I do want to ask you very briefly, is there a risk that with resources like ChatGPT or influencers, etc., we are at risk of making healthy people worried unnecessarily about their health?
Absolutely. And all the wearable devices, whether they actually lead to meaningful outcomes or more anxiety or full body scans.
10,000 steps.
10,000 steps. And actually fear sells. You sell and people sell against. So we see it with sleep. You're not getting enough sleep and not getting enough sleep. That's a big marketing trick, and fear sells.
Deborah Cohen, author of the new book, Bad Influence, How the Internet Hijacked Our Health. Thank you for coming into our studio here. A really fascinating conversation. Plenty more from us on the other side of this news.